Hi, thank you for joining me. Today I'm going to talk about polycystic ovary syndrome in adolescents. Now, polycystic ovary syndrome, or PCOS, is one of the most common hormonal disorders in women of reproductive age group, and it can occur in an estimated 6 to 10% of women in this age group. PCOS also happens in adolescents, but there are certain features which can make diagnosis in adolescents a little bit more challenging, and I'll discuss these today. Now, the classical symptoms of polycystic ovary syndrome are irregular periods or no periods due to the lack of ovulation or releasing an egg, or releasing an egg inconsistently. The appearance of unwanted hair growth and acne, and these are signs of an elevated, a relatively slightly higher amount of male hormone in this condition. Thirdly, weight gain, obesity, difficulty losing weight, and fourth, difficulty conceiving or fertility issues, again arising from the fact that often eggs aren't released regularly or sometimes not at all in this condition. So how do we make the diagnosis? So the diagnosis hinges on three factors. And in order to make a definitive diagnosis, we need two out of these three factors. The first is oligoovulation, or inconsistent release of an egg, or anovulation, which means not releasing eggs. So ovulatory dysfunction is one of the factors we look at. The second is an excess of androgens or male hormone, and the effects of that can be, as I mentioned before, unwanted hair growth. And when we talk about unwanted hair growth, we're talking about in specific hormonal areas of the body, such as in women, the upper lip, the chin, sideburns, chest or nipple hair, abdominal hair, hair on the upper or lower back. This is in contradistinction of unwanted hair growth elsewhere. So there are some people who have a greater propensity to grow hair. So they may have to shave their legs more often. They may have slightly hairy arms. And this is not the hair growth we're talking about. We're talking about hair growth basically in those specific areas I mentioned before. And the last is the appearance of polycystic ovaries on scan. Now, polycystic ovaries are, in my view, one of the worst named things in medicine, because everyone thinks that polycystic ovaries mean that you have gigantic ovaries full of ovarian cysts, and that's not the case. A polycystic ovary is an ovary where on scan we can see follicles, and follicles are the little sacs that eggs live in, so they're supposed to be there. But we can see an increased amount of an increased size, slightly increased size than is average. And here is a picture of a polycystic ovary, and you can see the little spots, the little dark spots. Those are the follicles which contain the eggs. There are no large cysts on this ovary. So in summary, again, what we look for is ovulation that's not consistent. That's number one. Effects of excess of male hormones. That's number two. And the appearance of polycystic ovaries on scan. That's number three. In order to make the diagnosis, you need two out of these three. So you don't need all three. So moving on to adolescents, why can the diagnosis be a little more challenging in teenagers? Well, because in teenagers, as we all know, and I've discussed at length before, it is quite common and even normal to have irregular periods for the first few years after periods start. And that is because ovulation or releasing an egg is inconsistent. So the first thing we look for is irregular periods and inconsistent ovulation. Both these things are quite normal in teenagers, so it's difficult to pin our diagnosis on that. The second thing is the effects of androgens or male hormones. And what we look for, in addition to blood tests, we look for things like unwanted hair growth, we look for things like acne. And again, as we all know, acne is very common in teenagers. So too, there is a bit of a rise in male hormone during adolescence, so that can cause a bit of hair growth as well. So again, these two things, depending on the extent, can be quite normal in adolescence. So what do we think is significant in terms of the effects of male hormones in adolescence? Well, we've got to, I guess, try to draw a line. So in terms of the unwanted hair growth, we view moderate to severe unwanted hair growth as significant, and the occasional stray hair, 1 or 2 stray hairs, are probably not clinically significant. In terms of acne, we view that is significant, that lasts a long time, so lasts longer than 6 months, and is resistant to kind of the normal topical treatments, then we think that may be significant and kind of above and beyond what we'd expect in normal adolescents. And the third thing we look for is the finding of polycystic ovaries on scan. And to make things even more challenging, it is quite normal for the ovaries of teenagers to look polycystic or have a polycystic appearance on scan. So we know that approximately 40% of teenagers who are absolutely fine will have this appearance on ultrasound scan. And some studies quote higher numbers than this. The appearance of polycystic ovaries on scan is so common in teenagers that as a result, it's taken away and out of the diagnosis in adolescents. So we do not use that parameter in adolescents to diagnose polycystic ovary syndrome. Many patients' parents are surprised to find this, and because of these things, there's a risk of overdiagnosis in adolescence. So some teenagers have an ultrasound scan, polycystic ovaries are seen, and they're labeled with that diagnosis. This is inappropriate, and there are several reasons for that. The first is we never want to make a diagnosis in anyone that isn't accurate. That's number one. And number two is when we give a diagnosis, we're not just saying words, we're actually saying that you've got this, and because you have this, you have increased risks of this, this, this. So there's a knock-on effect, and obviously we don't want to create unnecessary anxiety in anyone, and definitely not in adolescents, because that time of life can already be quite an anxious time. So what are the risks of polycystic ovary syndrome? So when we say we give a diagnosis of polycystic ovary syndrome, we are saying in the same breath that it may result in difficulty conceiving or fertility issues, which can be quite anxiety provoking. We are saying that there may be an increased risk of all manner of things, such as difficulty managing sugar, insulin resistance, type 2 diabetes, diabetes in pregnancy, high blood pressure, cardiovascular risks, fatty change in the liver, and increased risk of, for example, certain cancers like cancer of the lining of the womb if the condition isn't managed appropriately. In addition, with polycystic ovary syndrome, there can be issues with mental health, such as anxiety and depression. There can be eating disorders, and it can affect teenagers' quality of life. So that's why it's really, really important to make an accurate diagnosis for two reasons: not only to avoid unnecessary worry, anxiety, etc., also to, in an adolescent who does have the condition, to provide the necessary treatment and support in order to manage the condition appropriately. So if your daughter has a history of these symptoms, what can you expect? How do we investigate polycystic ovary syndrome? So we investigate firstly with the history. That's really important. So we ask about everything I've mentioned before in great detail. Now, it is important to note that sometimes these symptoms can overlap with various other conditions that can result in an excess of male hormones. Therefore, we can't just make a diagnosis on the basis of the history alone. We need to do investigations. And the investigations we usually do are blood tests and an ultrasound scan. So in the blood test, we're looking for various hormones, including obviously the male hormone levels, which are critical, but also hormones such as thyroid function, prolactin levels, female hormones, estrogen levels, etc. The ultrasound scan, as I mentioned before, we do not take the appearance of polycystic ovaries into consideration to make the diagnosis. However, we do an ultrasound scan because we want to have surveillance of the uterus and the lining of the womb, and we also want to rule out other things that can cause similar features. So that explains why we do an ultrasound scan. Once we have all that information from the blood test and ultrasound scan, then hopefully we'll be closer to making a diagnosis. Now, again, even this is difficult because the parameters for making a diagnosis in adolescence aren't as clear as in adulthood. So it's important to note that making an absolute nailed down definitive diagnosis isn't absolutely necessary in order to start providing treatment, because the symptoms again can be quite anxiety provoking, as well as the long-term issues can be significant. Sometimes the condition is in evolution during adolescence and may only completely be more obvious during adulthood. So we've made the diagnosis. What are the next steps? The next steps look to do three things. One is to improve the hormonal status of the girl. Two is to prevent longer term comorbidities such as diabetes, heart disease, lipid issues, etc., fertility issues. And the third is to improve her quality of life. For example, try to improve the acne, try to decrease, minimize, or eliminate the unwanted hair growth, treat obesity, because these things can have a significant impact on the quality of life of an adolescent, as you can imagine. In terms of management, the absolute cornerstone of management in these girls is weight loss and increase in physical activity. We know that between 40 to 70% of adolescent girls who have PCOS are either overweight or obese. And weight loss is almost the closest thing we have actually to a silver bullet, in that it improves most or all aspects of the condition. Because different girls will have different issues with polycystic ovary syndrome. So, for example, some may not have issues with acne or unwanted hair growth, but they may have no periods or very infrequent periods. Or the converse may be true. Some girls may not be overweight, but they have unwanted hair growth, etc. So it varies, and that's why care has to be highly individualized for these girls. In terms of weight loss, as I said, improves almost every aspect of the condition. For example, it can be very effective in restoring the menstrual cycle or restoring regular periods. It therefore improves fertility. It improves the metabolic issues associated with PCOS. It improves the control and regulation of sugars, of lipids. It decreases cardiovascular risk, and it decreases androgens as well. So if an adolescent is overweight or obese, this is our absolute primary goal: to decrease weight back towards normal and increase physical exercise. We also know that increasing physical exercise increases one's positive outlook, has good effects on mood as well. Our second treatment or line of treatment is the combined oral contraceptive pill. Now, it's important to note that we may be limited in the girls in which we can use a combined pill, because girls who are overweight, it is not appropriate to put them on the pill because of unacceptable risks, for example, of blood clots or DVTs. An important effect of the pill is that it decreases the amount of free androgens or free male hormones. So there will often be a beneficial effect, again, in terms of acne and unwanted hair growth. The pill will also give regular periods, not actual periods, but withdrawal bleeds. But the important effect of that is that it protects the lining of the womb, because if girls go long durations of time not having periods, it increases their long-term risk of cancer of the lining of the womb. So we know that women should have at least one period every 3 months in order to maintain the health of the lining of the womb. So if that is not happening, then she will need to go either on the pill or on a progestogen to provoke a withdrawal bleed every 3 months. The type of hormone we use, again, is related to her weight or body mass index, because the risks will vary. But this is an important aspect of treatment of this condition, having a regular withdrawal bleed or protecting the lining with either the pill, the Mirena coil can also do it, etc. The next option is metformin. So metformin is a drug that is commonly used in diabetes, and often there is a family history of type 2 diabetes in girls with polycystic ovary syndrome or women with polycystic ovary syndrome. And metformin helps with the regulation of sugar. It can help with weight reduction, as well as the control of glucose and insulin, and it can also help with the reduction of male hormones and unwanted hair growth. Metformin in itself is less good at menstrual or period regulation than, for example, the pill would be. Another drug in our toolkit is one called spironolactone, and that is in itself an anti-androgen. So it works against male hormone, so that can help with acne, and it can be quite successful in helping with acne, and it can also help with unwanted hair growth. It won't have any effect on the metabolic consequences, however, of polycystic ovary syndrome. So again, we go back to weight loss being absolutely paramount in this condition. Spironolactone can have adverse effects on a male fetus, so that in a girl who is sexually active, it is imperative that she be on reliable contraception. So if appropriate, it can be used, for example, with the combined pill, which also provides contraception, as well as the spironolactone together. The last drug I will mention, and mention briefly because it's not used particularly often, is another drug called finasteride, which again can help with the excess androgen levels. And again, lastly, I will mention that weight loss, increased exercise are the most important aspects of managing this condition, and it's not something that we can do for you. However, there is support available. So all girls with this condition should have access to a dietitian or be referred to a dietitian or seek that help out yourself. And there are many helpful programs online that you can engage yourself with to try to help to increase your activity and lose weight. Again, we cannot underestimate, absolutely, I believe that mental health is as important as physical health, and therefore we can't ignore the fact that these girls are more at risk of anxiety, depression, eating disorders, and hence there should be access to psychological support where this is determined to be necessary. And certainly we should ask these girls about whether they're struggling with these issues. And if you are, please feel free, not feel free actually, you should. I encourage you to speak up and let us know that, let your doctor know that you are having difficulties with low mood, anxiety, so that we can help you, support you. We may not be able to do it personally as a gynecologist. However, of course, we'd be happy to refer you to a psychologist or counselor or some means of support in order to help you through this while you're working through the condition. The great news is, however, that although it is a lifelong condition, it is eminently treatable. We have effective treatments. It is a real, I always think every condition, every patient I see, I view it as a partnership. This is a really good example of a partnership where we do our part, but you've got to do your part as well. You've got to work on your weight, exercise, and together we can come up with a program that is effective in treating your symptoms and therefore gives you a better quality of life, a better long-term health outlook, and hopefully less to worry about. So, thank you for listening. Please, if you've enjoyed this video, please like the video, subscribe to my channel, or join us on my Facebook page, Gynecology Girl Talk. See you next time. Thank you for listening.